I'm Sarah Norton, and I'm a member of the wellness team here at GateHouse Media, and I'd like to welcome you to Simply GoodLife Snippets. Simply GoodLife Snippets is a series where we will introduce you to activities, benefits, and other resources designed to help you and your family get well and be well. Today, we're going to talk about the medical plans offered here at GateHouse Media.
Congratulations! You made it through open enrollment and enrolled in your benefits. Now that you are enrolled, we want to help you better understand the plan and some of the features designed to help keep you healthy and save you money. In this video, we are going to review some of the detail pertaining to the benefits here at GateHouse Media. Specifically, we will review plan terminology and provide information on preventative services. In our next video, Being a Savvy Healthcare Consumer, we will talk about consumerism and how that pertains to your healthcare choices. Understanding some of the terminology in greater detail will help you to feel more empowered to understand why it's important to be a smart consumer when getting medical treatment. It's important to make sure you are fully aware of what part of the costs you may be responsible for. Let's begin. In-network means that the insurance carrier has partnered with certain providers and facilities and have agreed upon rates. Out-of-network are those physicians and/or facilities that have not entered into an agreement or an arrangement with the insurance carrier. When you receive out-of-network treatment, your out-of-pocket costs typically will be higher. How can you tell if your providers, hospitals, or other facilities are in-network? You can contact TouchCare, Excelis Blue Cross Blue Shield, and even the doctor or facility directly. Knowing this information ahead of time can help save you time and money. Your primary care physician is the doctor you see for routine well and sick checkups and who is responsible for coordinating your care. A specialist is a provider who has training in a specific field like psychiatry, orthopedics, the endocrine system, etc. The premium is the amount of money that you and your employer pay for the insurance coverage. The amount that comes out of your paycheck is your part of the total premium. GateHouse Media also contributes to the total premium. The premium does not count towards any of your out-of-pocket expenses. Each of the medical plans offered at GateHouse Media require that a specific amount of money is paid out of pocket by the employee before the insurance coverage will begin for most services. This is one of the reasons it is so important to be an educated consumer. The deductible amounts shown in this slide are for in-network coverage. Out-of-network deductibles are higher. Once the deductible is met, most services will have a co-insurance rather than a fixed cost for the visit. In the example, we are looking at an employee, Kathy, who has met her deductible and is having a procedure costing a total of $1,000. For each of the medical plans, you will see what the co-insurance percentage would be and what the employee cost may be. This example is also in-network services only. Out-of-network may have a higher co-insurance. In our next video, Being a Savvy Healthcare Consumer, we will explore examples of how prices for the same service can be drastically different in the same area and how you can find the best service for the best price. A copay is a set amount that an employee is responsible for paying to their primary care physician and specialists. This applies only in the enhanced and basic PPO plans. The allowed amount can be a tricky concept. As I mentioned, in-network providers and the insurance carrier normally have agreed upon rates for services and treatments. This is the allowed amount and is the maximum amount the carrier may pay for the services. In some instances, especially in out-of-network services, a provider or facility may bill more than the allowed amount. In these cases, the insurance carrier will usually only pay up to the allowed amount. As a result, the provider may bill the patient for the difference. To protect yourself from unforeseen bills, it's a good idea to make sure that your providers and facilities are in-network. Thankfully, each medical plan has what is called an out-of-pocket maximum. While none of us want to find ourselves in this situation, it's good to know that should our out-of-pocket expenses reach a specific amount within one plan year, The plan will cover services above that amount at 100% for the remainder of the plan year. The out-of-pocket maximum in this slide are for in-network services only. Out-of-network, out-of-pocket maximums will be higher. It's also important to note that out-of-network services may not apply to your in-network, out-of-pocket maximum.
Now that we've had the opportunity to review some of the terminology in the plans, let's take a few minutes and talk about how you may be able to save some money.
Using pre-tax dollars is a way to save money on your taxable income. When you pay for your medical, dental, and vision premiums, you are paying for those benefits with pre-tax dollars. This means that the money you use to pay for those benefits is deducted from your gross pay, making your taxable income lower. Additional ways to put pre-tax money aside are savings accounts that you use to pay for your qualified out-of-pocket medical expenses. Employees enrolled in a consumer-driven health plan, or a CDHP, can contribute to a health savings account, an HSA. Employees can have pre-tax dollars deducted from their pay put into the HSA to help pay for qualified healthcare expenses. It's important to understand that the funds in an HSA and the account itself are yours. Even if you leave the company, the account will continue to be yours. Unlike a flexible spending account that we will discuss next, the HSA is not a use it or lose it type of account. It is yours as long as you continue to keep it open. However, even though you may continue to own the account, you can only contribute to the account when you are covered by a CDHP. You can also change your deductions into your HSA at any time during the year. This is not dependent on a qualified change in status or open enrollment. It is your account. Another perk to having an HSA is that the company will contribute $400 to an employee enrolled in the individual CDHP plan and $800 to employees enrolled in the family CDHP to help offset some of the initial out-of-pocket costs. There are two different types of flexible spending accounts, FSA. A health FSA and a dependent care FSA. First, let's review the health FSA. Only employees who are not currently covered in a CDHP plan can put pre-tax dollars in a health FSA to help pay for out-of-pocket healthcare expenses. It's important to know that an FSA does not stay with you once you leave your employer like an HSA does. You are also only able to make changes to your deductions at open enrollment or if you have a qualified change in status. Participants need to know the balances over $500 in the health FSA at the close of the plan year will be forfeited. All of these are due to Internal Revenue Service guidelines. The second type of flexible spending account is a dependent care FSA. The dependent care FSA is a pre-tax savings vehicle to provide employees the ability to put pre-tax dollars aside to help pay for childcare for children ages 13 and under. The dependent care FSA also does not follow the employee once they leave the company and has a use it or lose it feature. If the funds put aside are not used towards dependent care in the plan year, the funds remaining in the account will be forfeited. Finally, the dependent care FSA can only have funds added to or changed to it during open enrollment or as a result of a qualified change in status. Each medical plan at GateHouse Media covers preventative services at 100%, which are not subject to the deductible. It's important to know that depending on what is reviewed during a preventative visit, there could be fees. At your annual checkup, if the doctor discusses pre-existing conditions with you, ask if the review is covered under the preventative exam or if it will incur a cost. It is very important to discuss your conditions with your doctor. However, asking is a way to ensure that you are not caught off guard by any unexpected charges. Some of the preventative services covered under the plans can include annual physicals for adults and children, some immunizations, routine GYN visits, pre- and postnatal visits, and some screenings. It's important to understand that some preventative screenings are age-based and may not be considered preventative if you do not meet the age requirements. It's a good idea to check with your doctor's office, Touch Care, and/or Excellus Blue Cross Blue Shield prior to scheduling the test to confirm that it will be covered at 100%. The benefits provided through GateHouse Media are there to help you when you are sick, but also designed to help you be well and stay well. Understanding how your benefits work, what the terminology means, and the resources available to you will help you make informed decisions that will help you and your family be active participants in your health. The information in this Simply Good Life snippet is intended only as a general overview. Detailed information can be found on the Simply Good Life Benefits portal by contacting GateHouse Media Benefits, Touch Care, or Excellus Blue Cross Blue Shield. Thank you for joining us for this Simply Good Life snippet. Please join us for our next video on being a savvy healthcare consumer. Until then, thank you and be well.